So we are going to go back. Professor Leiba, I understand, is back with us, and we are happy to have him at this time. I know some persons may have joined after I gave the introduction earlier, so I'm just going to go back and introduce him. So Professor Leiba is Professor Emeritus of Educational Development at the London South Bank University. He has various qualifications across different disciplines, including a Master of Science in the Sociology of Education, MPhil in Health Promotion, a PhD in Sociology, and he is also a registered mental health nurse. He has lectured and conducted research on mental health care, interprofessional education and training, research methods, evidence-based practice, and conflict management. He has worked as a lecturer, senior lecturer, principal lecturer, head of division, senior research fellow, deputy dean, and also professor. Professor Leiba is available for consultation on mental health education and practice, interprofessional practice, as well as conflict management. He has an enviable list of publications on topics relating to health, mental health care, and interprofessional working. He's a patron of the Nursing Association of Jamaica in the United Kingdom, the Friends of the Heart Foundation of Jamaica, also in the UK, and Culture and Dementia, based in the UK. He's a panel member of the Joint Council for Cosmetic Practitioners. He functions as a magistrate on the Bromley bench, and he's also an associate hospital manager. Ladies and gentlemen, family members, caregivers, it's a pleasure to welcome Professor Leiba.
Thank you very much for inviting me. And I'm going to try and address some overall situations which I call challenging behaviors in people living with dementia. So overall, what I'm thinking of getting to you today is to present behaviors which are likely to occur at home or in care facilities, and try to use a person-centered approach, mainly from Andrews 2006, and also drawing on principles and philosophies around caring. But of course, there are no recipes, or at least I haven't got any. In each case, the individual's needs must be addressed. Furthermore, the ideas here are from my practical experience with both people deemed to be suffering from dementia, their families, their friends, and from students who report what they're experiencing. I'm trying here to reinforce your good practices and to suggest some alternatives. Of course, the COVID-19 pandemic has affected all care activities, both at home and in care facilities. For example, needing to attend to infection control measures. This produces, I think, new challenges, such as adding to the confusion. If a carer is wearing full personal protection equipment, this might frighten the individual. It's a new situation. And then challenges of dealing with the various tests that are now required to be done. So therefore, in this space, when we're thinking of COVID, we need to take on board the staff or the carer explaining and explaining and explaining why the procedure is necessary, to ensure that there's an understanding within the situation. Remember that other environmental factors will affect all interactions. For example, changes in routine can trigger agitation and other unusual behaviors. Of most importance, carers, whether at home or in a care facility, need to have support, someone or a group to share experiences with and to plan strategies. No one, as you've heard before, should feel alone. There must be a healthy environment for carers to enable them to provide the care that's needed. Because behavioral changes that are confusing and difficult to handle leave the person, the carer, partners, and family members feeling stressed, irritable, helpless, and sometimes hopeless. To meet the person's preferences is a primary goal. All of us have got different needs. And so we need to get at the needs to understand the meaning behind the behaviors and actions. And when these unusual behaviors occur, carers must be able to stay calm, not to show immediate emotional responses, and try to deal with the challenges effectively by remembering that the person has difficulty in expressing him or herself, and that frustration contributes to the unusual behavior and its severity. You might be able to creatively find ways to overcome the challenges and make situations manageable. And this is something you'd have to do over and over again. Always think the individual, the situation, and how you can be creative. Don't take the behavior personally and avoid arguing back. Always try out a number of different ideas. One doesn't work, you try something else. Other contributing factors may be pain, discomfort, poor eyesight, hearing loss, and even physical things like constipation, being too hot or being too cold. Individuals cannot express these easily, so therefore there might be behaviors which you will find unusual. Oh, I can see now you've got my video. All right, yes. Behavioral disturbances can also be caused by boredom or overstimulation, if there are too many people around and too much going on. Unusual behaviors are the individual's way of trying to cope in what they perceive as a stressful or strange situation. Remember too, there might be learning disability issues or mental health, mental illness issues. For some people, impaired memory may be experienced by difficulties in word finding. We all experience the tip of the tongue phenomena. But for the person with dementia, this is ongoing and can be distressing. Although they can describe an object and know how to use it, the actual name of the object can be elusive. And this can cause the person to avoid conversation with others and have difficulty in making a reply when spoken to directly. In conversation, therefore, keep comments short and simple. Try to ask closed questions. Would you like a cup of tea rather than would you like to have a drink? Never talk down to the person. Call them by the name they want you to. Don't make them feel undervalued. They must be reassured by the content of both your emotional expression in your voice and your body language. Remember that there is diversity at the individual level. All the people are not the same. Of course, there are men, there are women, ethnic group differences, ethnic and social sensitivity, therefore, is a must. Areas for individual needs identification includes, for example, age, religion, personal and oral hygiene, physical health, diet preferences, cultural activities, sexual desires, dress, entertainment, social practices, likes and dislikes. Any ethnically and ethically sensitive service cannot have a recipe for all. Questions must be asked continuously and needs must be met continuously. Find out about their particular needs and provide sensitive services. For example, if memory work is being used, there's a need to capture memories from their cultural communities. In all areas of work, find out what their needs are from family, friends, and themselves. Do the research and plan accordingly. This method must apply to all the people being cared for. Some behaviors, I'll offer some examples and some ways of managing them. For example, the idea of repetitive behaviors. People carrying out the same activity again and again, making the same gestures or asking the same questions repeatedly. Maybe it's because the person does not remember having done so previously, or it could be through boredom. They may go through the motions of activities previously carried out at work. Common activities such as asking the same questions over and over again, or keep asking the time. This could be due to the person feeling insecure or anxious about their ability to cope in the situation. Try to be tactful and be patient and encourage them to find the answers for themselves. For example, if they keep asking the time, suggest that they look at the clock themselves. It may even help to move the clock to a position that's more visible. They may be anxious about visitors arriving, and this can also lead to repeated questioning. Try to be tactful always when answering. Never say, "I've just told you that." Try to get them to find the answer for themselves. Other repetitive movements such as kicking legs, moving arms and legs, getting up and sitting down, packing and unpacking bags, rearranging chairs, etc., could relate to their former work. Encourage the person to do something active. For example, simply going for a walk, being in a walk with you. But remember to find somewhere to walk safely. Choose comfortable clothes and shoes, and to check their feet regularly. They could also be experiencing discomfort. Check that the person is not too hot or too cold, hungry, thirsty, constipated, or in pain, or is experiencing the side effects of medication. Another repetitive behavior is the multiple use of the telephone, phoning loved ones and family and friends over and over again, over a short space of time, because of course they forget that they've done it before. This is followed closely by people who demonstrate restlessness, pacing up and down, pacing, walking in circles, and also going up and down rooms and corridors. Fidgeting with their hands or legs and rummaging through their bags, boxes, or any container which contains objects. Check that all is well physically. Try to distract them with an interesting activity or some form of exercise. Let them pace somewhere quiet in safety where they're not disturbing others. Make sure they wear comfortable shoes to reduce foot problems. Try to occupy them with the use of their hands, stroking a soft toy, a pet, worry beads, or provide a rummage box containing interesting objects. Maybe they were good at sewing or model making. Maybe they can read books they like, or you could read such books to them. And of course, with electronic books and IT now, use information technology as much as possible. Listen to music, do sing-alongs. Remember the songs which they used to engage with and sing in their earlier years, familiar songs from the past. Whatever activity is possible, always include a discussion during and afterwards. And then, of course, we have situations where people are shouting and screaming, continually calling for someone, shout the same words over and over again, or scream or swear or wail loudly over and over again. They could be in pain. They could be ill, experiencing difficulties with visual perception, or hallucinating. They may feel distressed and anxious, stressed by the noise and the people rushing about them. So we need to think about the environment carefully that the people are in and what could be affecting their behaviors. If they're calling for someone from the past, Listen and talk to them about this period in their life. Check how the room environment looks, particularly, is it dark? Are there shadowy shapes and sounds that are unfamiliar and could be misinterpreted as feared or frightened objects? And the big one for me is when situations happen and we say there's a lack of inhibition. They may behave in a way that other people find embarrassing. They may undress in public, having forgotten where and when it is appropriate to remove their clothes. Inappropriate social and sexual behaviors, for example, touching self and others, and sexual gestures, actions, and words in public. Some actions, like lifting a skirt or fiddling with flies, may be a sign that the person wants to use the toilet. Try to encourage the person to move to a private area and try to distract the person. If they behave rudely, swearing, spitting, being irritable, and being aggressive, don't attempt to argue and challenge. Try to move the person to a private, quiet area, distract, and explain to the other people around what is happening. Encourage gentle, socially appropriate behavior. It's important to always uphold the person's dignity and prevent unnecessary distress. And of course, there is the whole area of slaps and scratches and aggression and challenging behaviors around relationships at that level. These behaviors could include verbal aggression, posturing body language, and actual contact violence. The carers need to resort to a lot of assessment and history, along with possible triggers, or rather to find the possible triggers, which might help to prepare the way and to look out for what could happen. Triggers such as, does this behavior occur at certain times of the day or night? When does it occur when certain tasks are being carried out? Does it occur when they're frustrated, or when they're not being understood, when they're bored, or if they feel they're being humiliated? Please remember that somehow the organization and the carer might be contributing to the state the person is in and might go some way to create aggressive and violent outbursts. So be mindful as to how you present yourself. Remember, the person is not being deliberately difficult, so don't take it personally. Check to see that the organization in the home or the organization in the care home is not contributing to the situation. For example, is there enough time to spend with the person when seen through care activities? Can you go at a pace and be unhurried? Do not try to discuss the angry behavior while it's occurring. Be calming. Discuss the behavior later when he or she has calmed down. Do not initiate physical contact during angry outbursts. Try to distract to more pleasurable topics and activities. Avoid topics which will anger the person further, and maintain calmness by not being confronting or blaming in your voice, in your language content, or your body posture. A lot of people say you calm the person down, but not many people say, how do you do it? Well, you do it really by your voice, your body, and the content of what you're saying. Keep a log of aggressive outbursts, and remember what it is and what's been demonstrated could be related to hallucinations, paranoia, or delusions. All these things could be happening. Do they get angry when tasks are too difficult? Sometimes this happens. So we always need to think, should we break tasks down into smaller bits, yes, so that they can manage and work through with us? Make sure the person and yourself are safe when aggressive and violence occur. Always ask yourself, do you consider this person to be dangerous to self or others? And if so, then get help, seek professional advice. There's a need with this situation to develop policies which states, what do you do if? Where do you call to for help? And what will the help do when they arrive? Furthermore, the ethics around restraint and the use of medication must be looked at and prepared for through training and reflection. Carers must think ahead. Do not just wait for a situation to arise and then we react. We should be planning ahead through discussion and through training. We should be developing policies which look at prevention, management, resolution, and debriefing. And always engage in problem-solving sessions with colleagues and family members in these sessions. Ask questions such as, what if certain situations and challenging behaviors occur? What will we do? How will we manage it? Use the problem-solving sessions to plan future actions. It's not unknown. Some people write these down and use them in teaching and learning sessions with new staff to reinforce good practice among the staff. And as we do this, we must address the multidisciplinary team and the interprofessional links of all the professionals and others that are linked to the persons. So we must respect the team members, ask for their help, involve them in discussions, plan prevention, management, and resolution and debriefing with all the people. So you have some sort of common language and common approach as in what you do. Sometimes people go for night walking and, you know, the body clock might have gone awry. Plus, they might need less sleep as they grow older. They may get dressed appropriately or inappropriately for the weather and go outside. This is dangerous. There could be a busy road or an area in town where people would not care about them and exploit them. Also, falls and accidents occur. So here again, I would say, use information technology and use the science around what exists to track people, to know where they are, cameras that can look around the buildings when people are leaving, so that you can prepare for it. So what I would do if I was working now, I would get all my staff together and I would discuss possibilities around this and draw up a list of what we could do and how we could prevent and manage such odd situations. So the whole thing becomes dynamic. We're not just sitting back and things happen and then we react. Make sure the person has enough exercise during the day. Try a walk before bedtime. During the summer, it might seem like daytime goes on forever. Have a clock which they can easily see. Consider issues of continence and the use of the toilet. Maintain comfortable sleeping environments. Engage them in enjoyable, meaningful activities. Develop structured daily routine. Know the person's history. If they used to work at nights, it might explain why they want to stay up and walk about during the night. And of course, we get the dilemma with people hiding things and losing things. They may hide objects to keep them safe and then forget where they put it. They may feel insecure and want to hold on to things that they still have. They may not remember where or indeed that they've hidden the items. And this could lead to some accusations of stealing, causing distress to themselves, their carer, and the people around them. Try to know their hiding places so that you may tactfully help them to find their property. Put documents and articles safely away and keep spare keys to cupboard. Some people may also hide food, and that may result in food being unfit to eat later and be a health risk. And this links in very closely with notions of challenging behaviors around suspiciousness. As the ability to process information declines, the person may become suspicious of other people's motives. If they have mislaid an object, they may accuse someone of stealing it. Due to failing memory, they need to make sense of what's happening around them. They may imagine that people are trying to harm them, or that they're being taken advantage of. Be calm, reassure, and distract. Distract them with a change of topic, a drink, or a change of activity. Remember, this feels real to the person. Explain to others that the mislaid objects may be around but just hidden. However, do not dismiss the suspicions and their accusations without investigating thoroughly. There is a possibility that the suspicions might be true. Overall, some general tips to keep in mind. Remember that the person is not deliberately being difficult. Ask yourself whether the behavior exhibited is really a problem, and whose problem, and how we need to deal with it. Try to put yourself into the person's situation. Imagine how they might be feeling and what they might be trying to express. Remember, all behavior is a means of communication. If you can establish what the person is trying to communicate, you will resolve the problem quicker. But a new problem might come tomorrow. That's just one thing. You need to be creative. Distract through calming activities. I use distract a lot. You might say, well, how do you do this? What is it all about? Music, paintings, book reading, listening, stroking a pet or soft toy, massage, head or hand, the use of water for play, for swimming, for baths, jacuzzi, aromatherapy, reflexology, relaxation, images and pictures of the past, singing songs they remember, and having foods that they love. Remember to engage in problem-solving discussions about what could happen and how it could be dealt with. You know, think, we're here, this is the day, the people, whatever. What could go wrong? Discuss this beforehand and draw up a plan for manage, to prevent, to manage, and then to debrief afterwards. Use all these ideas to develop policies, to teach each other, and to practice safely, ethically, and sensitively. These policies must be seen as dynamic and flexible. You don't just come up with a policy and that's it in stone. It would continuously be revised and changed according to the people, the situation, and also according to the multidisciplinary team, which is doing the discussion. Because each member of the multidisciplinary team will bring a different focus to the fore. If you cannot contain a behavior, even watching it, have someone else take over. If you find the behavior too difficult for you to deal with, ask for help, ask for advice. Know about medication, and particularly the medication the person is on, because you've got idiosyncratic responses. And be particularly good at understanding side effects and finding out from them what side effects they could be having. Ask for help and advice from relatives, friends, health professionals, and of course, the supporting dementia societies and organizations. I would suggest that the challenges and difficulties which we face with the person who is deemed to be living with dementia, we can go a long way if we start to think about prevention, yes, how you prevent things. If it happens, how you manage it, and then how you resolve and how you debrief the staff. So it becomes a dynamic learning situation, not recipes, and no policy is going to be set in stone, but it will change according to the individual, the organization, and the particular behavior which is being demonstrated. I thank you very much for listening through to me, and I think I've got a reference and a game which I think was developed in Holland, which I will email the details to your host today. Yes? Thank you very much. Thank you.